multiple forms of inequality and discrimination faced by individuals and groups, which can put them at a greater disadvantage. To basically understand the impact of intersecting identities, data systems therefore need to move beyond one-dimensional categories to capture combined disadvantage by multiple attributes, such as sex, gender identity, age, location, wealth, ethnicity, and so on, in order to identify population groups most likely to be at risk or excluded, thereby allowing for more targeted interventions. Now, before I give the floor to our fantastic lineup of panel members who are representing both national statistical offices as well as civil society, a few housekeeping notes. You're welcome to enter your questions and comments in the chat box at any time during the session. We will also be posting a few open text polls during the session in the chat box, and we encourage you to participate and share your perspectives from your own context and work. And after all panelists have spoken, we will open the floor for a Q&A segment where you can use the hands raise function to make an intervention. So with that, I will now invite Shaida Baidi. Many of you already know Shaida. She is the Managing Director of Open Data Watch and is the Senior Advisor on Gender Data to Data2X. She co-chairs the SDSN Trends Group and is part of the Technical Advisory Group for the Global Partnership for Sustainable Development, as well as a member of the Paris 21 board. Before co-founding Open Data Watch in 2013, Shaida was at the World Bank and was the director of the Development Data Group for several years. So Shaida will deliver opening remarks, and she will also provide us a high-level overview on operationalizing intersectionality across different stages of the data value chain. So Shaida, thank you for joining us, and over to you.
Thank you very much, Sharita, and welcome to everyone. Really a pleasure to be here and co-hosting this event on behalf of the Gender Data Network with our colleagues at ESCAP. For us, this event, the Stat Café, is very valuable and very special. So being here means a lot to us, and we really appreciate being invited and having a chance to talk to you. So today we are going to be, as Sharita said, talking about intersectionality, and we're using the data value chain as a way of communicating all the different aspects of what needs to happen for integrating intersectionality into our data systems. This is the work that we have started for a couple of years now, and we have made quite a bit of advancements in terms of consultations, working with different work streams, for example, the cooperative on citizen data, with the groups that are working on CRPS, with many groups working on SOGI and sexual orientation and gender identity data. So we're making some progress trying to understand best practices and what needs to happen. And in fact, tonight we're really, really pleased to be using the Stat Café as a special event to soft launch a report that we are publishing, and we are very lucky to have Elizabeth Lockwood with us, who's the key author of this paper, to present it to us later on. So it's also a special treat for this Stat Café to be the first ones who see this very special report that you will see. So I'm just going to take you a few slides, if I can get help to start up my slide deck, just to take you through a few slides on kind of setting the scene of what we are talking about on operationalizing intersectionality across the data value chain. Can I have the first slide, please?
To all our panelists, if you could, since we are centrally managing the slides, if you could say next, that would be helpful. Thank you.
Sure.
Shaida, do you want to move to the next slide beyond this? Because we've already moved the slides.
Oh, okay. Um, is that what you see? You see the big slide on the operationalization of intersectionality?
We see the case for more intersectional data.
Oh, okay. Sorry, I don't see that. I'm not seeing that. Okay. So so I just going back to the first to the slide that on the definitions of intersectionality. I think Sharita did a great job of defining the intersectionality. I just wanted to emphasize again that's very important aspect to keep in mind, that is we are trying to understand the experiences and the challenges that many people are facing, individuals who occupy multiple and intersecting group identities. And in fact, if we go to the next slide, we see that the case for more intersectional data is very important, that we have lots of available data illuminating kind of critical development challenges, but many of them, just knowing like 1 in 3 women have experienced gender-based violence, or 129 million girls around the world are out of school, doesn't quite tell us exactly understanding all the unique challenges. So in that sense, intersectionality data gives us those nuances that uncovers all kinds of patterns, root causes, differentiated experiences, which many of the compounded disparities and underlying factors that we see are to inform targeted and impactful interventions. So it's really important to keep in mind as why we need intersectional data. Next slide. We've been thinking about how to talk about operationalization of intersectional data. And we thought the data value chain would be a really great way for having that conversation. Data value chain, as you see, has 4 stages of collection, publication, update, and impact. And the whole idea of the data value chain is to take us through all the different stages that data has to go through, from raw data that's been collected to when it's used and has had an impact and really has changed minds and improved policies. So I'm just going to take you through 4 quick slides of some examples of what we need to do under each one of these segments for intersectional data to be incorporated into our data systems. Starting, of course, with the next one, which is collection. And collection is a tremendously important step for the intersectionality, because that's where you bring all these questions or the problems that we want to solve into consultation. And of course, for intersectional data, we need to adapt a lot of our data sources, like household surveys or administrative data, or relying on citizen-generated data, or maybe even qualitative information, and so on. So it's very important that when we design intersectional data systems for collection, that we would keep in mind a few considerations that I have here. One important consideration is that we have to much more have a meaningful engagement with people that the data is coming from. So it's much more important to work with civil society organizations and learn ways and methods where we can collect much better data and more disaggregated, but much of higher quality. The second thing, as I just mentioned, we need to build better ecosystem of data sources. So household surveys and administrative surveys and administrative data and other sources are kind of part of an ecosystem rather than silos and separated from each other. So in fact, when you're working on intersectional data, more and more you look at it and work on it, you see that in fact, the data ecosystem is improving while you're improving the data that you need for intersectional data. And one of them is the shifting of the balance of data ownership, where you start building much more data engagement and more agency in data for people who are providing us the information that we need. For each one of these sections, I'll just give you a few of these considerations, but also we have in the work that we have done, we have best practice examples of each one of these areas. For example, for collection, we have a very nice story of the engagement that in Morocco that they had in improving the way the data was collected for violence against women, and actually that resulted in very good data sets. Let me go quickly to the next one. The next one is publication. And publication is where the raw data now it becomes available for public access. And it's tremendously important for intersectionality that this section, publication, is very carefully designed, because we want for intersectionality, you need to bring a lot of insights from data, learn from data, and analyze it. So you have to build those uh, into the data system for how to capture the meaningful insights and how to make the data more accessible in many formats, and also how to get the data stewardship system within the country to guide more of inclusive and equitable data production. So publication is tremendously important, again, for intersectionality. And the example that we have here is in the UK, where they use the sexual orientation data that they had from census and other surveys, and they packaged it in a very nice way, making it available for public to know and also for decision makers. The third one, I'm very close, Sharita, to ending. The next one, next slide, is uptake. Uptake is where, in the process of the data value chain, we connect to the users. And this is, again, for intersectionality, is very important to connect to the users for understanding connecting and understanding what their needs are, and try to kind of intermediate between the data side and the usage and uptake side, and to be able to build capacity for use. So the example that we have here is Kenya, where they actually use their inclusive data action plan and to finance and build capacity for uptake of disaggregated disability data. So it's a very good example there. And finally, the last one, the next slide, is on impact. And the impact for intersectionality means that we really want to see that that data has informed decision, and there's an impact from it. So basically, for intersectionality means that we have to monitor all the time, not only just use of data and impact, but also the ethical considerations, the security, privacy, and all the other issues behind the data. So impact is very important in this context, and also for strengthening the feedback loop and building trust in data. The example that we use here is also extremely good example of in Brazil, when they use the data collected to address some of the disparities related to maternal health, and seeing some really big impact from that. My final slide, the next one, is just to give you an idea of some of the actions that we are pursuing right now, and it would be really good to get your feedback and also, maybe collective efforts. One is on standardizing intersectional data practices. Some of the examples I mentioned to you is what we are, trying. And of course, you will also hear from Elizabeth on the disability and intersectionality, as what kind of standards are being applied. Mobilizing resources, intersectionality is very complicated, so we really need to have resources to build data use and data literacy, to kind of, get more into adapting some of our data sources. So that's very important. Developing case studies has been tremendously important for this work. And if you know of any cases in your countries, help us to define it and to document and disseminate that. And of course, last but not least, is collaborating across other movements. One which we are very proud of is the work that we do in collaborations with this amazing collaborative on citizen data, and of course with others. So the last slide is just to show you that we have a very nice and easy to read pamphlet on integrating intersectionality in data systems, going over some of the areas I talked about. And here you see the QR code that you can scan and use. But we can also put the link in the chat. Sharita, over to you. Sorry, I went over a little bit, but there's a
that's
lot
all
of
right. Thank
material.
you, Shaida. Thank you very much for setting the scene here with your insights and basically emphasizing the need for mainstreaming intersectionality in all segments of the data value chain in order to build a strong and sustainable national data system. So with that, we'll move to the next segment where we're going to hear from our colleagues from countries, basically country experiences. But at present, we've just posted a poll in the chat box, an open text poll, to get your views on where you see the most potential to apply intersectionality in official statistics in your context. So please feel free to pop in your responses into the chat box, and you can view the responses through the word cloud. But in the interest of time, I'm just going to introduce and invite our next speaker, Ms. Sarah Omache. Sarah is the Assistant Manager at the Kenya National Bureau of Statistics and is the coordinator of the Kenya Strategy for Development of Statistics. She also champions the process of harnessing citizen-generated data for official reporting in Kenya. So Sarah will talk to us about inclusive data practices in Kenya with a focus on gender and disability and the impact of such data on policy in Kenya. So Sarah, thank you for joining us, and over to you.
Thank you, everyone. So I'm going to have quick slides to talk about how we've had inclusive data in Kenya and how it has informed policy, and ultimately how it's changing people's lives and how it's going to change people's lives further. Next slide, please. First slide. So my main areas of focus is highlighting the inclusive data practices in Kenya. Then specifically on how citizen data reveals marginalizations and intersectionality. Then I'll also talk about the impact of inclusive data on policy in Kenya. Next slide, please. So one of the overarching practices is that Kenya is a member of the Inclusive Data Charter. And from the charter, we developed a national Inclusive Data Charter action. I think Shaida mentioned that, and we're implementing the same. The charter brings out elements of inclusive data and commitments to the same. For instance, all population must be included in the data. All data should, wherever possible, be disaggregated in order to accurately describe all population. Data should be drawn from all available sources. That's including the emerging sources, including citizen data, big data, geospatial data, and other sources. Those responsible for collection of data must be accountable. That is the producers as well as the users and the supporting partners. Human and technical capacity to collect and analyze data must be improved, including through adequate and sustainable financing to ensure that the data is of quality and is well representative. Next slide, please. Other practices, apart from the ones that are enshrined in the Inclusive Data Charter and the National Action Plan, are participatory practices. For instance, in all data collections, there's active stakeholder engagement across the value chain. There's user engagement to ensure that the data that we produce and disseminate is aligned to the uses of all the users and all the changing users. We use citizen-generated data. So far, we've used CGD to fill a number of indicators in the national SDGs indicator framework. We do lots of, this is a repetition on stakeholder engagement across the data value chain. We also do ground truthing, particularly by visiting the citizens or the sources of data, the institutions, and conducting focus group discussions to try and validate the data that we get from the households or from the farms. Collecting and analyzing inclusive disaggregated data. the usual disaggregations, and others that affect the citizens or that are cross-cutting and overlapping. That is the issue: the sex, the gender, disability, migration status, income level, residence, ethnicity, among others. Next slide, please. During analysis and including during data cleaning, data analysis, and processing the data, we address intersectionalities as opposed to handling marginalizations in isolation. So if we handle each marginalization in isolation, it might not reflect the overlapping or the people who are facing multiple marginalizations at the same time. And this is also applies to the time when we are analyzing the data as well as when we are presenting the data. And another good practice is that we are trying as much as possible to integrate qualitative data and quantitative data so that we can look at both sides, the kind of revelations that can be brought out from perceptions, from people's views, so that they can be used to complement the numbers that we have from quantitative sources. Next slide, please. To be specific on citizen-generated data, one of the strengths of citizen-generated data is that it brings out these marginalizations and intersectionalities that might not come out in the official sources. For instance, we get data at the grassroots. We all understand that in official statistics that sometimes we do not get data at the lowest levels possible. But for CGD, in some interventions or in some initiatives, we are able to get data at the grassroots. And the civil society organizations interact with the citizens directly on issues that affect the citizens. So in this sense, we are able to get the data that the things that affect the citizens, including the overlapping or the intersectionalities that affect them or are directly linked to them. CGD also provides qualitative data. Many civil society organizations collect data on perceptions of citizens, and this includes the marginalized groups. Next slides, please. It also reveals information on very important topics or subjects that are not revealed in official metrics. For instance, people's sexual orientations that are not the ones that are commonly known, albinism, gender-based violence, information on commercial sex workers. For instance, there's a time we collected data on the underground economy, and we had to get to reach to the commercial sex workers, and we had to go into their registered groups or support groups to get a frame or to get into contact with the sex workers. There's also female genital mutilations. This data can be obtained from civil society organizations and non-state actors more than from the official sources. CGD complements official statistics by providing data points or whole indicators. For instance, in between DHSs, which sometimes have a time lag of 8 years, we can get producers of CGD providing data in between so that it can provide that trend information. Next slide, please. So from the inclusive practices, a number of policy implications have been observed. For instance, the Inclusive Data Charter. Kenya is a member to the Inclusive Data Charter, and this promotes disaggregation of data to ensure that all the groups are represented in data. It has promoted capacity building and accountability and transparency in data. So the three elements are being achieved through being a member of the Inclusive Data Charter and implementing the National Action Plan that was developed in line with the same. That is for the period 2021 to 2025. Persons with Disability Act was signed this year in May because of the data that has been available, following up from data from official sources and from CGD, and also what has been achieved from implementing the IDC Charter. We also have the Persons with Disability National Policy, which was also developed, and it was also officially put out for launched in 2024. That's after the Persons with Disability Act.
Sarah, could you please start wrapping up?
Come again?
Could you please wrap up?
Oh, okay. I think I'm going to the last slide. Yeah, other policies include the National Care Policy, which aims at recognizing, redistributing, and compensating unpaid care work. This is as follow-up from the Time Use survey that was done in 2022. So it provided information that informed development of the National Care Policy. There's also the Intersex Bill for the year 2023 and the Legal Notice 13 of 2025, which was informed by data that was collected from 2019 census on the intersex population. There's also the government commitment to address statelessness based also on the census data through pledges on the segment on statelessness. And finally, there is the Children's Act 2022. I think that's my last slide. Thanks.
Thank you. Thank you, Sarah. So basically, Sarah's presentation really shared insights on emphasizing how citizen data as well as qualitative information can help identify and shed light on groups that are likely to be at risk of exclusion, which is typically goes beyond the way official statistics has been done. With that, let me invite our next speaker from Fiji. We have Meli Narakuta. Meli is Principal Statistician at the Fiji Bureau of Statistics, managing the Social Statistics Division, which produces vital socioeconomic indicators for national policy. And he also plays a key role in Fiji's Civil Registration and Vital Statistics Committee, driving improvements through the National Action Plan for CRVS. So Meli will talk to us about two cases of data analysis that were done by the Fiji Bureau of Statistics in collaboration with ESCAP. And these case studies primarily used existing administrative data combined with relevant household surveys to unpack intersectional identities and target groups to strengthen gender-sensitive policies in Fiji. So thank you, Meli, for joining us, and over to you.
Bulavanaka, thank you, Sharita. I also like to thank my colleagues Sarah and Shaida for their eye-opening presentations. Bulavanaka once again from Fiji. On behalf of the Chief Executive of the Fiji Bureau of Statistics, I'd like to first take this opportunity to thank the organizers for the opportunity. Just to brief introduction, Fiji's civil registration, the CRVS system, is the foundation for legal identity and vital data on births, deaths, and causes of death. Beyond counting events, the CRVS helps us ask who is being left behind. By applying an intersectional lens with the disaggregating by sex, age, ethnicity, location, and mother's marital status, we see important patterns. For example, the children of adolescent and single Itoke or indigenous mothers are less likely to be registered on time, and the cause of death patterns differ between Itoke and Fijian of Indian descent. Next, please. Thank you. In Fiji, we had, with the assistance of ESCAP, we had developed two policy briefs or two policy papers. And with these, we had engaged with CRVS stakeholders, which consulted and identified gender-sensitive policy priorities. And here is a list of government ministries and departments that were part of this policy brief, the development of the policy brief. The project was called Evidence to Action, or the E2A, which was implemented by the department in support with ESCAP and partners. A consultative approach was taken, and the national workshop was held and organized involving these key ministries. Other national agencies and CSOs were also engaged to firstly identify priority policy areas of interest in the context of civil registration and arrived at a consensus on the focus. There are various official sources of data in Fiji, such as the national census, the sample surveys, uh, the highs and the mix, and also the administrative sources, which provide key gender variables beyond disaggregation by sex and age, such as unpaid work, gender-based violence, and women's mobility. For the data use, project mainly administrative data from the Civil Registry and the Ministry of Health and Medical Services provided relevant variables, mainly administrative data from the Civil Registry and the Ministry of Health and Medical Services. Next, please. For the first policy brief that was developed, the first area of priority identified by the national stakeholders centered around adolescent pregnancy and motherhood. So to better understand the intersectional identities of adolescent mothers, as well as the impact on their health, education, and labor force participation, to inform how policies could increase the autonomy of these groups in decision-making about the timing of motherhood. This was also in line with SDG 3.7.1 on the proportion of women of reproductive age between 15 to 49 years who have had their need for family planning satisfied with modern methods. And SDG 3.7.2 and on adolescent birth rate aged 10 to 14 years and 15 to 19 years per 1,000 women in that age group. Next, please. So there are mainly two ethnic groups in Fiji, the indigenous Fijians, or the Itoke, and the others who fall under the non-Itoke. So the study found that while adolescent fertility was found to steadily increase among both ethnic groups, it was higher for Itoke in the poorest wealth quintile and in rural areas. Most adolescent mothers of Itoke children were single or unmarried, and unmarried sexually active adolescent girls had the greatest unmet need for contraception. Next, please. So based on these findings, two types of policy recommendations were made. Firstly, those that benefit the target groups directly, such as the healthcare worker training and health curriculum for high school students. And secondly, recommendations that call for improvements in the institutional setup as well as data, such as the routine collection analysis, publication of fertility and family planning data by ethnic specific disaggregations, which is yet to be published in Fiji. Next, please. The second topic of priority that was identified by the stakeholders in Fiji was on identifying target groups for addressing disparities in on-time birth registration to identify and determine the magnitude of disparities in on-time birth registration, magnitude of disparity among population groups by factors such as sex, ethnicity, maternal age, and marital status. When financial incentives previously provided by the government tied to on-time birth registration are not available any longer. So this was mainly inform policies and programs aimed at alleviating inequalities in birth registrations and access. Birth registration data for children born from January 2016 to 2018 was obtained from the Civil Registry, and the proportion of births registered on time during this period was determined by the sex and ethnicity of the child and maternal age and marital status. Next, please. On-time birth registration in Fiji involves registration of the child's birth within 12 months of birth. It was found that on-time birth registration was almost twice as likely among non-Itoke children, higher among children of married and older mothers aged 20 and above. Next, please. Again, the policy recommendations that emerged from the study were firstly those that benefited the target groups, such as providing mobile registration services and reinstatement of incentives tied to on-time birth registrations. And then there were recommendations to improve data linkages between, for instance, the Ministry of Itoke Affairs or the Indigenous Affairs and the Civil Registry, as well as the health system and the Civil Registry, including the digitization of health system birth data. Next, please. So with these policies aim to benefit women and girls. A dissemination workshop presented key findings and recommendations, and we invited all relevant ministries and departments and agencies involved mainly in the welfare of women and girls, as the Minister of Justice was in attendance, and the policy recommendations were converted to a cabinet paper. Next, please. So what can the statistical system in Fiji do to address intersectional data issues? Here are some of the area of focus and what needs to be done that we have come up with. And the main thing for the civil registry that needs to do to improve the use of ethnicity variable is just to improve the way ethnicity is being recorded. So currently it is binary groups. We have Itoke and non-Itoke, or indigenous and non-indigenous. We know that almost all the non-Itoke or the non-indigenous group is Fijians of Indian descent. So, but by not recording it as such as the unique characteristics of the Fijian with Indian descendant population are not able to be utilized in targeted interventions, because Fijians of Indian descendants are aggregated together with the very diverse other ethnicity group, which is the other Pacific Islanders, Asians, Europeans, and others. So the civil registry need to update the ethnicity variable to Itoke, Fijian of Indian descent, and other at a minimum.
Melly, could you please start wrapping up?
Sure. So the current work under the GGP has, we've standardized the geographic variables in the civil registry dataset. So the next step is updating the database to drop down lists so that the routine geographic analysis of place of birth and the place of birth registration can occur. So what the current gender GGP project we're currently working on has done has enabled the implication of what it matters on this slide to be able to be done. However, system improvements need to be made so that these can be done routinely in the future. Thank you.
Thank you, Melly, very much for demonstrating basically how intersectionality was applied in Fiji in the data analysis and use end of the value chain, basically revealing that adolescent fertility as well as delayed registration are not experienced uniformly, but differ significantly by socioeconomic position. And Melly, in his last slide, has also pointed out some limitations in using existing data for intersectionality analysis, and what are some of the possible improvements that are required in the Fiji statistical system in order to make more robust gender analysis possible in the future. So thanks once again, Melly, and we'll move to our last speaker who's going to bring in a CSO perspective. We have now put in a second open text poll in the chat to hear your views on what's your biggest challenge in integrating intersectionality across the data value chain. So once again, please feel free to type in your responses in the chat box. May I now invite Dr. Elizabeth Lockwood. Elizabeth is CBM Global's representative at the United Nations, where she develops advocacy strategies to raise awareness and strengthen capacity and lobby for the rights of persons with disabilities in partnership with organizations of persons with disabilities. And she basically co-leads the UN stakeholder group of persons with disabilities data advocacy efforts. So Elizabeth's presentation will highlight the role of organizations of persons with disabilities as key actors in generating and using such data to influence policies and programs. So Elizabeth, thank you for joining us, and over to you.
Thank you so much. I'm very pleased to be here and to be presenting a summary of the findings of the Open Data Watch report on intersectional data and persons with disabilities. So this report, which the link will be shared in the chat, is framed around the framework that was shared from the very beginning of this session, but looking at it from the perspective of organizations of persons with disabilities and how they collect their data that is missing. And I interviewed 3 different organizations of persons with disabilities and will now share some of these findings. Next slide, please. Just quickly as a background, persons with disabilities make up 16% of the world's population, so that's 1 in 6 people. It's a quite significant part of the world, but persons with disabilities are not a homogeneous group. They have such diversities and intersectional identities, and so it's very important, building on the previous presentations, that we really understand these barriers and enablers for persons with disabilities. And we're missing a lot on disability data, so this intersectional approach is really quite important. Next slide, please. There were 3 studies that we looked at in the report. The first one is from Ecuador, and we looked at deaf people's quality of life using a mixed method approach. And the second one took place in Mongolia, looking at gender-based violence and deaf women, also with a mixed method approach. But interestingly, this was the first time that data were collected by deaf people using Mongolian Sign Language. And then the third example is in the Philippines, which is ongoing, being replicated. And it's a profiling of different disability groups, in this case, in the city of Las Piñas, and really led by this community-based disabled people's organization. Next slide, please. So looking at data collection in all 3 projects, the community leaders really established mechanisms for members to engage in the data process. So this was quite important to ensure that there was feedback, that they were getting the information they needed, and to frame the data in an intersectional way. The OPD, or Organization of Persons with Disabilities, leaders reached out and communicated with their members in various ways. This could be WhatsApp messages, other ways, videos and sign language. And OPDs always know how to reach their members the best. And this is why it's so important to always include them in data collection. And so you'll have more accurate numbers. And they will also be able to reach the most underrepresented persons with disabilities. Next slide, please. Interestingly, when we looked at data use, not all the data that were collected were shared in the end. And I'll explain why in the next slide, but a lot of this was to protect the community members. And you can see in this slide, this is actually from the data collection in Mongolia. Next slide, please. For example, the data in Mongolia was originally shared, but the names were protected of the women. But even just sharing gender-based violence against deaf women was misused by the public. So later, the Deaf Culture Center decided not to share the data publicly like that again, to protect the deaf community and the deaf women. And what they did was they shared the data instead in general human rights reports. So this was a learning that they gathered. And in Ecuador, certain aspects of certain deaf people were not shared, such as LGBTQ deaf community members were not shared to protect their identities, because deaf community can be very small. So this was another reason. Next slide, please. Looking at data impact after the data collection, the leaders, the OPD leaders, came back to the community and met again for feedback. And this was a very important part of the process. And through this process, lessons were learned mutually. So both from the leaders and the community members, data literacy was increased in 2 of the cases, and also policy changes were effected from this process. Next slide, please. For example, in Mongolia, the deaf women who participated felt that the data accurately reflected their lived experiences. And we find that this doesn't always happen. So this is really important that the OPD-led data in this case really reflected the reality. And the women also learned certain aspects through the data collection and trainings, what violence really was. So they may have understood a certain type of violence, but they learned more and then how to cope with this violence. So very positive impact in this case. And in the Philippines, the data really shaped policy. So in launching the recommendations, once the data had been collected, there were different department entities, so Department of Labor and Employment in this case, were present. And when the department learned of the gaps in employment for persons with disabilities within a certain age range, they immediately provided slots for these persons with disabilities to have jobs. So this was a great example of data shaping policy immediately from the data. Next slide, please. And the benefits of intersectional data, I think there are many, myriad, but from this report, it was really a beneficial way to better understand the unique barriers and experiences of these persons with disabilities and their intersecting identities. And the data ultimately influence activities, programs, and policies to become more inclusive. And I will share just a few examples in the next slide, which is my last slide. The Ecuadorian government plans to use these data findings as a baseline for the next 4 years to track relevant policy changes. The caveat is if they have the resources, but it's still a great step in the right direction. In the Philippines, many programs now are more inclusive of persons with disabilities, and more specifically, such as stroke support groups. And this is what came out in that intersectional data. And then finally, in Mongolia, the findings showed, interestingly, that violence, gender-based violence, did not matter if the woman, her education, her age, where she lived, it really occurred everywhere and could affect any woman. And the intersectional data findings really helped understand violence against deaf women in this context. And I will finish there. So thank you so much. And I'm happy to answer any questions.
Thanks, Elizabeth, basically for highlighting that with increased participation and voice of relevant groups in collecting and governing data about them, there can eventually be improvement in the overall availability and use of data for these groups in policymaking. So thank you very much for those insights. And with that, we have a few minutes to move into the Q&A session, and I'm going to hand this over to my colleague, Miriam Ait Oyaya. Miriam is the Gender Data Network Coordinator at Open Data Watch and has been working in the field of sustainable development and statistical development for several years with the Government of Canada, with ECA, as well as more recently with Paris 21. So Miriam, over to you for the Q&A segment.
Thank you, Sharita. And so I can open the floor. I see we have a few questions already. One, from Rakesh that are quite specific, so I don't think I will ask them. We don't have too much time, and it will be difficult for those speakers to answer that. I've been told by Sharita that Meli will answer Salahattin question in the chat. So that's good. And we have also, so if you have more questions, please raise your hand. In the meantime, we had 2 questions from the registration. One from Caroline from Nigeria, who asked, how can we adapt existing instruments like household labor or time use surveys to better reflect intersectionality without overburdening respondents? And what methodology or framework best capture intersectionality data in large-scale national surveys? And so I'll address that to our speakers, maybe first to our NSOs, the National Statistical Offices. So I don't know if Sarah, you would like to tackle an aspect of that question, and then I'll pass the floor to the rest of the speakers if they want to add something. Sarah.
Yes, let me give a quick comment on the question. I'll start off from the prevention of overburdening the respondents. I'll give the Kenyan example of the last time use survey that was done. The time use survey was integrated into another survey that was ongoing on the Living Standard Survey or the Integrated Household Budget Survey. So the time use questions were integrated into that questionnaire so that we could capture all the data without having to conduct a time use survey separately. So it reduced overburdening of the respondents, but at the same time, it collected data that could be connected to each other. As we are collecting indicators on living standards, we're also collecting data on time use survey to combine, to look at the time use indicators in relation to other indicators that are collected in the living standard survey. So I feel that's one approach of looking at the intersectionalities. As we are analyzing data for other purposes or for other objectives, we are also looking at the time use data in relation to the same data. I hope that responds to the question.
Thank you, Sarah. And I don't know if Meli or anyone else want to quickly add something. All right, so I have one more question, and then I think given the time, we'll wrap it up. And this one, I'll address it maybe more to Sheda and Elizabeth. How can countries with limited resources use intersectional data to make real policy changes?
It looks like Meli wants to come in. Miriam?
Sorry, Meli. Sorry, go ahead.
Sorry, Mary. Yeah. Well, thank you, Mr. Stella, for the question. Okay. Thank you. For maternal education in Fiji, the maternal education is usually not collected in the civil registry. However, it is collected during the census and surveys, not surveys, which is why they're often missing in registration based disaggregation. Whereas for the rationale behind picking the independent variables, yes, mostly based on the relevance of the policy and also, most importantly, the availability of data, which is that has been consistently recorded in the registration or the notification forms. And for Fiji, with the full multivariate intersectional analysis on sex, age, ethnicity, and marital status simultaneously is rare in CRVS outputs. Yes, well, for intersectionality, does implies multivariate analysis. I agree, and in the case of Fiji, this is something that will require a well-structured CRVS data plus strong analytical capacity. Thank you, Mr. Pasali. Thank you, Miriam.
Thank you. Thank you. Sharita, do we have time to address the second question?
I think we can do that in 1 minute.
Okay. Perfect. So, Sheda or Elizabeth, do you want to say one sentence or two? Do you want me to repeat the question?
Yeah, very quickly, the question was how countries with limited resources use intersectional data to make real policy changes. I think that's really terrific question. We have to spend quite a bit of research time, but I think the examples we saw today are really good example of using citizen-generated data and partnering with civil society organizations is one example. And the other example is what we saw from Fiji, from Meli, who's using the administrative data sources, not really building new administrative system, but using the existing data to make a case and show the value of intersectional data so that you can build the case for it. Just a couple of examples, but there are, of course, much more than that. Thanks.
Great. Do you want to add something, Elizabeth?
I completely agree. And I would just add that I think multi-stakeholder partnerships are also really important. So in the Philippines, the Las Piñas example was funded by the organization that I work for, CBM Global, but also now I think as we go on, there'll be other partners who can fund it. So I think you can have different funding sources at different times and you can build that way as well. Thank you.
Fantastic. Thank you. So then I'll wrap up the Q&A with that, and I'll pass you back the floor, Sharita.
Thank you, Miriam. We are at the top of the hour. Unfortunately, we're not in a position to take any further questions at this point, but this has been an insightful session for me personally, and hope it's the same for all our participants. We've highlighted the importance of inclusion in all stages of the data value chain, from collection and processing to analysis and uptake, and as well as the power of using participatory approaches and citizen data for better inclusion. So with that, on behalf of ESCAP, Open Data Watch, and the Gender Data Network, I would like to thank all our participants and panelists who are joining us from across many different time zones. This has been a very productive session, and we hope to organize a series of sessions on this topic, if possible, potentially covering more on techniques, models, and practices for working with intersectional data. And we'd love to have you join us in future sessions. So until then, good day and good evening, wherever you're joining us from. Thank you and bye-bye.
Thank you. Bye.
Thank you. Bye.